When you have uterine prolapse, can the uterus actually come out through the vagina and fall off? Let me show you. Today we're going to talk about uterine prolapse, where the uterus comes down, and I'm going to show you in real time what that looks like. So let's start with my favorite anatomy 101. This is a side view of a female body, heads up here, legs down here, front here, back here. This is a schematic that I use all the time for my patients to help them understand their anatomy a little bit better and actually physically see what is protruding from their body. So the first thing you see is the bladder, which holds our urine. We urinate through the urethra, which is this opening right here. Behind the bladder, we have the vagina. The vagina is like a cylinder. You have a top wall, a back wall, and on top of the vagina is where you have your uterus and the cervix. And the cervix is right at the tip of the uterus. And behind that, you have the rectum, which collects stool, and then you have bowel movement through the anal opening. This is a normal anatomy, which means all the organs in the pelvis, the bladder, the uterus, the rectum, the intestines, everything is where it's supposed to be because all the connective tissues, the ligaments, the pelvic floor muscles are holding them in place. Uterine prolapse happens when these pelvic floor support structures are not working, and as a result, the uterus, instead of being in your abdomen, is going to come right out through the vaginal opening. So now I'm going to show you what that looks like. Keep looking. This is normal. Keep your focus on the uterus, which is right this organ right here. And 1, 2, 3, go. See what happened? Going back to normal. The uterus is where it's supposed to be, and boom. Uterine prolapse, where the uterus is coming out right through the vaginal opening and protruding outside the body. Now you can imagine how uncomfortable this can be for patients. They're complaining of heaviness, pressure, feeling of bulge, not being able to be intimate, not being able to empty their bladder properly, not being able to empty their bowels properly. Not to mention the scary thought that an organ is actually protruding outside, and will it fall down? What will happen? Is it cancer? Can it become cancer? To learn all this information, go check out my this week's YouTube video that talks about uterine prolapse. Trust me, you'll learn a lot about your body and thank me in the process.